Hi, everyone. Hi. So, thanks for coming. My disclosures at the beginning of this session are, I should have paid more attention when the titles for sessions were run by me. I would say the content in this session is less about our safety and justice focus area at Code for America and more about the criminal justice system, kind of 101, a bit aimed towards, oh, fun, okay, whatever. A bit aimed towards, I would say, like, civic technologists or other people who are interested in these issues who maybe would be interested in a sort of primer around what do local justice systems look like, what are the different agencies, who's in the justice system, who's in our jails, sort of just 2015, local justice system, what's up? There are some people in the room who might also be expert in that, and feel free to pipe in. I think when Code for America hired focus area leads, the focus areas, even though they're much narrower than everything that cities do or everything that counties do, they're still super broad. So, for example, policing, not something I actually have tons of experience in. I see that we have our good friend Laura White from the city of Indianapolis, who probably knows more about policing than I do. So feel free to pipe in, or anyone else, as we go along. So we'll do a bunch of Justice System 101 and then a little bit at the end about CFA's role. What do we mean by the criminal justice system? So the structure varies a lot, actually. I'm learning even more now that I'm working nationally that the structure of justice agencies and how justice services are delivered throughout the country really does vary quite a bit. But in general, at the city level, we've got police departments. So CFA has actually done most of our work historically at the city level, and so that's been a lot of who we've worked with and who we worked with this year. But we're starting to do more work at the county level because, as you can see, there are many, 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 many more justice agencies at the county level. Sheriffs, district attorneys, public defenders, probation, victim services. And even though courts are generally administered statewide, there tends to be a county court in every county that handles criminal cases there. Let's see. And then state agencies, we've got, and I should say the sheriff, I think Chief Wilson mentioned this in his remarks, but sheriffs typically run the jail. So the jail is at the county level. And then state agencies, we have courts, administered generally or organized at the state level, and then prisons, parole, Attorney General, Victims Compensation Board. But there are definitely some states where probation is also delivered at the court level, at the state level. So there's a little bit of variation, but this is, I think, generally true. And then tribal agencies, depending on the size of the tribe, there are, particularly I think in the U.S. Southwest and the Mountain West, there are tribes that have their own justice systems that interact in various ways with local justice systems. And then the federal system is a whole other justice system that we're actually not going to get into because we're focused at the local level. And then the private sector also plays a huge role. So many services are contracted to the private sector. I think probably the thing that gets the most play, like in the press, is private prisons. But I think much more common, there's like services that are wholly contracted out. So not just IT services, which is what we hear about a lot at CFA, but for example, medical services are frequently contracted out at the local level. In a jail, there's like a few big vendors of jail medical services in the country. And then sometimes the county does deliver those services, but they're often contracted. Yeah. Yeah.
And it's an important one because it gets lost a lot.
Yeah.
And what we call those non-traditional data sets is actually municipal courts.
Yeah.
And the reason I mention that is because in Colorado we have municipal courts, and it's at the municipal level where we see ordinances against homelessness.
Yep.
And so when we talk about that social change, so I would add municipal courts to that because that's where you're going to pick up those communities.
Yes, that's a great point. And just a larger point about courts is that, I kind of am acting in this slide like there's one kind of court, but there's actually a ton of different kinds of courts. So there's like family court, there's,
Right, there's
Right.
Do your civil commitments,
Yep.
your criminal.
And all of those things in various ways can feed into the other parts of the justice system, including the jail. So great point. Thank you for adding that. Okay, we're not going to get into detail on this, but this is basically how people might move through the criminal justice system. It's like a little flow path. As you can see, the basic point here is it's really quite complicated.
We call that the plumbing diagram.
Yeah. So, and I think also important to note about this slide is that it's not to scale. So here we've got, it's a little harder to see because it doesn't quite fit on the slide, but this is crime. And this is reported and observed crime. So I actually would say there's quite a bit more crime that happens compared to reported and observed crime. I mean, I think this is probably derived from a victimization survey, but there are many sort of like victimless offenses that would probably be classed in here in reported and observed crime that aren't falling in there. So probably a lot more crime is happening than is demonstrated here. But then I think more importantly, when we move through here, this is so entry into the system, prosecution and pretrial services, adjudication. So in the adjudication section, you can see trial up there at the top, and then guilty plea. That looks like about the same amount of people go to trial as plead guilty. That's like totally not the case. About 95% of people plead guilty. Maybe 5% of people go to trial. That actually might be like understating it. So that the guilty plea path should be a ton bigger. And yeah, but this is just basically to show sort of, people flow through. There's a lot of different paths people can take. There's a lot of different decision-making points. And in terms of sort of principles of 21st century government, if we're thinking about using data to improve decision-making, all of these junctures are places where data could be used to improve decision-making. And typically, it's not very available. Part of the reason why, actually, is because all those agencies that we looked at typically have their own information management system, and they do have interfaces where they communicate with each other, but they tend to be like a one-to-one, and they don't share all the relevant information. Any questions? All right.
That says 1967 at the bottom.
That came from the Bureau of Justice Assistance. They actually created that map.
Adapted from the child. Yeah, I think there is some source material that comes from earlier, but clearly, like pretrial services was not a thing, I don't think, in 1967. I think there's definitely been some modernization of this diagram since then. Okay. So this is actually, so I stole some of these. I didn't make all the new visuals for this slide presentation, so this is from a report that I made about California, but the general point is true across the board. Crime is down. So here we've got crime in 1960. Over there we've got crime in 2010. When I made this visual, that was like the most recent data that was available. So, we saw a peak in the 70s and 80s, and then we've kind of been largely, there's been some peaks and valleys, but generally speaking, we've been on the decline for decades in terms of crime rates. And the other, I think, point to draw out here is that violent crime has also experienced some peaks and valleys. If you made this bigger, you'd see more of that. But it's a very small proportion of all crime. Oh, okay, and here's where people are. And so I think a lot of times when people talk about the justice system in the media or elsewhere, there's a lot of discussion about prisons. And there are a lot of people in prison. As you can see, the prison population has grown very substantially since 1980, on the order of, it's about 5 times bigger than it was in 1980. But there's also a lot of people in county jail. So this is more of the local justice system level, and then completely dwarfed by the number of people who are on probation. So most people who are involved in the justice system are under supervision in the community. And that's a huge, I think, overlooked often way that people interact with the justice system. Did you have a comment?
Yeah, I was going to say, are those numbers adjusted for population, or are they just...
No, actually they're not. And it would be interesting to add in, but our population in the U.S. has not quintupled from 1980 to 2013. I think when I made this, I initially did like run those numbers. It's on the order of like, I think our population has increased by like maybe between 50 and 60% since then. So yes, you would expect to see some growth, but not this scale of growth. Okay, so now we're going to talk a little bit more, like honing in on the local level. And apologies to the Vera Institute. I stole many of the visuals we'll now see from now on from a report that they made about local jails recently. So many more people spend time in jail than prison. Most have not been convicted of a crime. So we looked previously, the slide before was like the total number of people in prison or jail at any time. So there are more people in prison than jail at any time. However, because people's lengths of stay in jail are generally really short, a lot more people cycle in and out of jail in a given year than spend time in prison, because frequently people are sentenced to fairly long term in prison. They have less churn in the population. So here we've got state and federal prisons, 631 people spend some time there or are admitted annually, and then 11 million, almost 12 million people admitted to local jails. So a jail is actually also, in addition to probation being a really frequent like way that people interact, an admission to a local jail is also really much more common than people spending time in prison. And most people in jail are awaiting trial, or they're awaiting, because we talked about how most people plead guilty, about 95% of people plead guilty. Most people are like awaiting the time when they're like, oh, I really want to go home, fine, I'll plead guilty. So yeah, and then 38% of people are serving a sentence, and they might, or there's actually something that's kind of missing in this diagram, which is people who are not necessarily convicted, but they're spending time for example, a probation violation. So there's a population of people who are haven't necessarily committed a new criminal offense, but they've violated some term of being out in the community. And so that, I don't actually have good figures on that. I think it's actually tracked really in varying ways, but I've been talking to a lot of counties about jail data this year, and I've been consistently asking them, about 10 counties that I've talked to, how many people do you think are in your jail for technical violations? And the estimates range from like 30% upwards to some people have even said as high as like 60% of people. That would be of like that convicted group, not the whole. People aren't typically like awaiting trial on that. So yeah, yes?
You can put this off, but in California there's been this realignment. Is
Yeah.
that the right term for
It is the right term.
mixes the populations considerably.
Yeah, and that's actually happened. Some similar things have happened in a lot of states that have done justice reinvestment. I can't remember your name. What Rick is referring to, if you're not familiar, in California, we've been undergoing for the last 5 years or so, maybe 4 years, a huge transition in our criminal justice system that's a result of some long-standing litigation about conditions in our state prison system related to the provision of mental health services that actually went all the way up to the Supreme Court, the one that John Roberts is in charge of. And they said, you have to reduce your prison population. It's unconstitutionally bad in there, which is pretty wild. So we had to make some big changes, and part of the way we dealt with that was by passing a law called Public Safety Realignment that said, typically before in California, if you were convicted of a felony, you went to prison. Now, you only go to prison if you're convicted of a violent or sexual felony. If your felony is non-violent, non-serious, non-sexual, you go to county jail. And that's actually posed a ton of challenges at the local level. Actually, you don't have to go to jail. You could also go to county probation. It's posed a lot of challenges for counties because they're trying to avoid replicating some of the same issues that got the state in their litigation at the local level. And some counties have been really innovative with the way that they also got a lot of money realignment. Well, I don't know. I think no county would say they got a lot, but they got some money to deal with the new group of people that were under their county justice system control, and some have done some really cool creative things with that, and others have really been challenged. And actually part of it, this is a really long answer, but thanks, you've asked a question. So in terms of the physical plant of jails, many smaller jails in California were really not built for people to stay for years. They don't have any programming space. Sometimes they have a yard, but it's like in Marin, for example, I've been in there, it's like you see the sky like 6 stories up, And if you're in there for a felony term of even like 18 months, it's pretty rough. So it's been interesting. But actually, if you heard the panel earlier today, Lenore Anderson was talking about Prop 47. That's the other thing that finally did bring us under the PLATA threshold for prison population. Public safety realignment got us almost there, and then Prop 47 took us fully under. So anyway, but I know in a lot of states that have done justice reinvestment, they're dealing with that same issue of how do we deal with people that used to be in the prison population at the local level. Okay, so probably people have had time to read this, but a lot of people, nearly 75% of both sentenced and pretrial populations are in jail for nonviolent traffic, property, drug, or public order offenses. So it kind of depends on the state and the county, but it could be like failure to pay child support, or like I said, some of these violations of terms of probation, or the stuff that's listed here. Oh yeah, and people have a lot of health problems. Much more common in jail to be suffering from serious mental illness than it is in the general population, and that's particularly true of women in jail. Women who are in jail tend to be much more commonly there serving time for drug and property offenses that are often, or I don't want to say often because I don't have firm numbers on it, but tend to be perhaps contributed to by underlying co-occurring mental illness and drug addiction. And then substance use disorders, as you might expect, are much more common among jail inmates than among the general population. And that's not necessarily to say like those folks are serving time for a drug offense, but that's just an underlying health issue that they have.
Also, the Center for State Governments did a survey in New York City and found that for those who were in jail for serious SMI and/or behavioral co-occurring, they had a longer length of stay in pretrial in jail than those who, let's just call the average population itself.
Ooh, I think we might talk about that on the next
Do you have that?
slide.
Yeah,
No. Oh, shoot, that's a racial disparity slide. I'm not sure we're going to get to that slide. So let me say, yes, you're totally right. The National Sheriff's Association did a study on this in Rikers and in a prison in Florida, or a jail in Florida, and found that people who were in for the same offense, if they had serious mental illness, some spent 10 times, I think in Rikers they spent 10 times longer in jail, and it's because, well, there's a whole ton of reasons why, but basically it's not a therapeutic environment, and people often kind of have trouble following the rules, and there's varying like levels of quality of mental health services that are available in jail. Some are quite good and some are not, but people tend to kind of go into crisis in those situations.
Or it could be that a judge knows there's no resources out in the community.
That is also true, yes.
And so when they're considering pretrial...
Yeah, they don't get the placements, yeah.
Right.
Yeah, that's true too. That is an excellent point, and the point was that when judges are making a decision about pretrial release, if someone is in need of mental health services in the community and those resources are not available, or if there's a wait list for them, then they may not, they may be less likely to actually make the decision to release them versus somebody who doesn't need those services. That is true, and that is something that I'm very hopeful that the Medicaid expansion can start to help address. Because previously, previous to the Affordable Care Act, virtually no one in jail had health insurance. And so it was really about, like, can the safety net help you with the placement? And now it can be a little bit more as we grow our capacity of providers, which is not going to happen overnight. but we do have the opportunity to draw a lot more federal dollars down to the local level to build out our mental health treatment capacity. So that's, I don't know, that's just whatever my plug for Medicaid. So racial disparities, you're probably well aware of this too, but if you are Black, you're much more likely to spend time in jail than if you're white. And Vera just, put white and Black in their diagram. I think it should probably also be stated that if you're Native or if you're Latino, you're also more likely to spend time in jail, but not as much more likely. Black people still experience like much higher rates of incarceration even than Latinos or Native Americans, even though those rates are also disparate. Once in the system, it's tough to get out. So I think somebody said this from the stage this morning too. Within 3 years of release, this is a California figure, about 2/3 of released prisoners are rearrested. And that's actually the bulk of that group of people who are rearrested. Most people are rearrested in the first year, and probably even within the first 3 months of getting out. Oh yeah, I said that, right. More than half are arrested by the end of the first year. And we could have a whole discussion about why that is. Yeah.
Is this the first arrest or is it any arrest?
So
the tagline says once in the system is first tough to get out. So.
It's tough to kind of get out of a cycle of involvement with the justice system. So, and part of this is because a lot of times if you get out of prison, you have a mandatory period of parole after that, and actually anyone who people are watching more carefully, you're more likely to get caught breaking the law. That's one piece of it. But then there's also just pieces along the lines of what Lenore was speaking to this morning, that if you have that scarlet letter F on you for a felony conviction, it can be really difficult to find stable housing. There's a lot of barriers to employment. So it's just really challenging to stay out once you kind of have that mark on you. Despite crime being down, obviously people are still being victimized by crime. In fact, it's a really big problem in some communities. Violence is still way too high in some communities in our country, and young, low-income men of color are the most likely to be victims of violent crime. They're also the most likely to be repeatedly victimized. So I've done some research about victimization, and what I have found in California, at least, is that victimization really crosses all demographic categories. Being victimized once, but being victimized over and over and over again, it's likely to be young, low-income men and women of color. Over half of violent victimizations are not reported to the police. And then the factor that's most predictive of whether a person will be victimized is whether they're already a crime survivor. So that gets at some of that repeat victimization. Repeat victims often experience symptoms of trauma. So that could be trouble with relationships, anxiety, depression, trouble sleeping, a lot of sort of physical manifestations of trauma and anxiety. And few crime victims are able to access services to help them recover. So in terms of, I think a lot of the really exciting work that's being done at CFA right now to improve service delivery in general, I'm actually really excited about thinking about how we might apply that to the delivery of victim services, because that system is very hard to navigate. And okay, so here's the challenge. We kind of touched on a few of these things. We're making a lot of decisions without data. The system defaults to the most costly solutions, and some of the solutions actually seem to make the problem worse. So that's our challenge. And that's why I think CFA's decided to invest in this area. Although we're still figuring out where the technology levers are, and like I said this morning, there's a lot of other pieces that need to come into play besides technology. but the opportunity is moving towards a system that's efficient, laser focused on outcomes, and fundamentally fair. I think the ground is more fertile for that change than it has been in a long time. Certainly, it's more fertile than I ever thought it would be in my lifetime. Yes?
I have a question. It's possible it didn't make it in your slideshow yet.
Yeah.
But are you also including the death penalty and the process of that in the scope of your work?
So no, and part of I guess the easy answer for why that is that we're working at the county level. So capital cases are typically not really as close of a nexus to the county level, but it's certainly an important issue. So right now, there's a broad consensus for change in the justice system. Bipartisan, federal, state, local. This is something that everyone is talking about and wants to do something about. Incentives align. So by that I mean fiscal incentives. A really, I think, good example of that I kind of referenced earlier is the Medicaid expansion. Correctional health costs are like by far the largest contributor to growth in jail budgets, prison budgets. It's a huge growing piece of that puzzle. And before the Affordable Care Act, whether somebody was locked up or whether they're out in the community, the county is really going to pay for their care. Now, because Medicaid doesn't pay for care that's provided in a correctional environment, all of those costs fall on the county in the case of jails. But if someone is in community-based treatment, they're probably part of the expansion population for Medicaid, the newly eligible population. And so those costs, at least until 2017, are 100% covered by the federal government and will be covered at least 90% forever. So there's a huge fiscal incentive, particularly for people with behavioral health challenges or even also chronic disease in general, to find community-based alternatives to jail stays. It just makes a lot of sense for local budgets. Yeah.
So just so we're clear on the scope of the CFA effort here, is this
Yeah.
criminal justice in the sense of from the moment somebody gets arrested, or are you looking at things earlier than that, like support systems in the community to keep somebody from ever?
Yeah. Yes. And
Yes, which?
I don't know if you were. Well, I'll get to that. But I don't know if you were here when I first was introing, but what I'm talking about now is not really that much about what CFA is doing. It kind of is, but like more, it's just criminal justice 101, like Jenny's thoughts. Here we are. But in terms of where I think it's prudent to invest CFA's resources, or just resources for improving the justice system in general, like as far upstream as you can go is the best, right? I mean, so that's why people like to work on pretrial maybe now instead of reentry as much. Like there's much greater focus on pretrial, I think, for some of the reasons you're talking about. But prevention is like the key to all of this for sure. So I mean, and I think that's also why I'm really excited to be working alongside our health and human services focus area and our economic development focus area, because I think there's actually some really great work that we could do at the intersections there. For example, we're speaking of like 2016 fellowships, we've been talking about nurse-family partnership a lot with one of our sites, and that fits way more squarely within health and human services focus area, but it's one of the only things that's really been like longitudinally extensively studied and shown to reduce juvenile arrests. So I'm really excited that we're working on that and want to help contribute to it. Same with actually some work we're exploring in foster care, because foster care is a huge feeder into the justice system as well. So yeah, we definitely want to be swimming upstream on that stuff for sure. Okay. Oh yeah.
I'm sorry.
Yeah, no, please do. No, this is like total conversation. I realize I'm in the room with like people with more expertise than me.
I did want to level set something. When you said that Medicare, I do want to say that when you are under supervision, whether you're in community corrections or probation, most of them are actually not eligible for Medicaid, because that is because you said something that kind of gave the impression that they could be.
Unless you are in a custody environment, you can receive Medicaid.
Right, so in like Colorado.
Right. Oh yes. Oh, you're from Colorado. Right. Yeah. It gets complicated.
So I didn't
yeah.
even give anybody
everybody being.
Yeah, sorry. If you are in a halfway house that is government run, or if you're in some other sort of work release facility that is government run, I actually think the Center for Medicaid Services is going to evolve on that. But yeah, that there is sort of a gray area around what it means to be under correctional control for purposes of Medicaid. So yes, you're right. But for people who are just living in their own residence or in supportive housing that's privately run or whatever,
Like probation and
Yeah.
parole.
that's
Yeah.
all good. Yes.
Yeah.
So yes, thank you for raising that.
Jenny?
Yeah.
I'm going to think out loud here for a minute, addressing the question about the prevention part.
Yeah.
Actually think about both reentry and prevention, that if you can do both, like we've also got a reentry program that I've been helping with that we actually employ reentrants on a graffiti abatement unit. So they can earn their wage, pay their court
Yeah.
fees, child support, all that business. But I would say 3 out of the 8 guys we've had work for us,
Yeah.
they get to 2 months before they're ready to be done, and they're like, I just want to do something to get put back in.
Yeah.
The idea of having $10 left after paying all their fees, all their bills, and and making decisions.
Yeah.
They're used to somebody else making a decision, but if you can attack both, like with I'm thinking of the Snap app that they explained
Yeah.
in the big
Yeah.
session, that we have multi-service centers in Indianapolis, about 6 of them.
Yeah.
And so either if you need a service, you're not in the criminal justice system,
Yeah.
but that idea where you can link up
Yeah.
through an app, or if you're a reentrant, everybody's got a phone. That's the thing.
Yeah.
Everybody seems to have a phone.
Mm-hmm.
They could get linked up to services a lot easier.
Yeah.
I'm thinking you could attack both issues.
I totally agree. I think a lot of the work that's going on at CFA right now around eligibility screening and around enrollment and streamlining service enrollment processes is super promising for finding some ways to incorporate it into our safety and justice work, especially because sometimes there are some little tweaks that we could make to that would make it work better for people in the justice system. Medicaid being a great example. Before I came to CFA, I worked on jail Medicaid enrollment, and it's really tricky. Even though you're eligible for Medicaid when you're in jail, you're not supposed to get, Medicaid is not supposed to be for your care, and because we're moving to managed care in most states, it's tricky because there's a monthly capacitation fee that goes to your health coverage provider no matter what, even if you don't see a doctor. And so a lot of states, their social service, their welfare systems have to change in order to accommodate actually enrolling people in jail into Medicaid. And it's a great time to do it when people are in that reentry population, because there's really high morbidity the month after people get out of jail. And so being able to connect them so they can stay on their meds or whatever they did to sort of stabilize when they're in jail is really important. I agree. I think I want to grab all of that great work that's happening in social services at CFA, hopefully fold it into our safety and justice work, and then make whatever changes, or revisions we need to make to have it be very to serve this population really well. Yeah. Okay. Oh, right. So they all overlap. That was the point. So this is where I'm focused right now. Although I have to say I've been at CFA for 7 months, and I just keep talking to a lot of people in local justice systems, and my frame changes a little bit probably with every conversation. But right now what we're focused on is safely reducing incarceration. So that could have to do with risk assessments. It could have to do with really sort of focusing in on some of those prime populations that people want to bring down and impact, like the mental health population, pretrial population, technical violation population, all of those, and try to figure out sort of how we can use technology as a lever to impact on those targeted groups, and then connect the right people to the right interventions. So that's part of what we're talking about with respect to sort of, unfortunately, our correctional system as a huge social service provider. And then strengthen the practice of community policing. So a lot of that great work that we saw on Vallejo and Indianapolis talking about today, and that we're hoping to continue with some other fellowships next year, particularly focusing next year on pre-booking diversion. So that's basically diverting people to services and away from an arrest or a booking into jail, which actually kind of hits our safely reduced incarceration too. So that's what we're working on.
Where is that taking place?
It's awkward, I want to say, but we're not supposed to say because we're still nailing some of the sites down. Yeah. So sorry, but you'll find out soon.
But is it going to be city level or county level?
The police project is city level, and we're working on another sort of user-friendly courts project next year that's going to be county level. I don't think any of those people are here. So. But I love you. Okay, so this is just a picture of our practice. We have our jail management track, so it's our safely reducing incarceration track. And then we have our community policing track. So the tools in jail management are this jail population management dashboard that I talked about on the main stage earlier, which we built in Louisville in 2013, that basically extracts data from a jail management system and visualizes it not just for the sheriff and jail staff, but for district attorneys, judges, people who are making placement decisions, whether that's probation or judges, so that they can basically visualize some of the outcomes of their decisions and sort of discover trends around that. We're going to be piloting that in 3 new jurisdictions next year, not as part of a fellowship, but as sort of an attempt to try to scale some of our really promising prior fellowship work. CourtBot is the tool we built for Atlanta that texts reminders about your court date, and there's a few different ways that we're continuing to work on that project. One I can definitely shout from the hilltops about is a great partnership with our St. Louis Brigade, Living Cities, and the New Neighborhood Indicator Project. Oh, sorry. For the video. They're doing a project in the St. Louis courts around sort of helping people navigate the courts, reminding them about their court dates, understanding sort of requirements, and just helping people successfully get through that process. And then Change My Record. This is actually an effort that really borrows a lot from the Get CalFresh work that relates to food stamps that you heard about earlier. Prop 47, a ballot measure that passed in California last year, enables people with old, low-level drug and property felonies to file a request with the court to have those felonies taken off their record and marked down to a misdemeanor. The process is not the easiest. All the counties have a different form, and they're like kind of hidden like on the county court website. They're all PDFs, a lot of intimidating legalese and just like bad design. So we're making a simple web form that people can use for a variety of different counties that just is really easy to understand, collects a little bit of information, and then on the back end we fill out the PDF and file that with the court for people. And yeah, so that's Change My Record. And then our community policing track, our product pipeline is, so one of those places is Seattle. And then Comport, that's our tool we built with the city of Indianapolis, and we're hoping to spread to a lot of other police departments that are part of the White House Police Data Initiative and have committed to opening up data sets about policing practices. Many of them use the same internal affairs software that Indianapolis uses, and so there's a lot of interest in the connector that Chris built to help sort of live those commitments in other cities. And then in each of these tracks, we have a community of practice. Well, we will. I'm still actually trying to think through how we can. I think there's going to be a lot of value in networking local justice leaders across the country that are working on these issues. I've participated in communities of practice that I feel like I got a lot out of that make you feel less alone, kind of like the summit. But I'm trying to figure out the way that we can construct those communities so that they're not just lifting up things that are innovative, but that are hard to apply, like in people's real work, and try to figure out how can we work on things in an applied way together, so that it's really clear, like this is making me more effective, like this month and in the next 3 months. So I'm thinking through that. If anyone has thoughts, I'd love to hear them. And then we're supporting the White House Police Data Initiative. So that's your 2015. We'll see. 2016 maybe we'll just like iterate the heck out of this and look totally different. But yeah. So I think that's Oh yeah. Let me know if you want to. Let me know what you're working on. Let me know if you'd like to partner. I appreciate you all for coming. If you have questions, give me some questions. All right. Oh, okay. What's up?
We would like to join Health Superintendent. I'm with Maricopa County. Oh, thanks. I work in Arizona, Maricopa County Department of Public Health, but I actually work for a nonprofit. But we try to pull in the private sector to help with programs that are going on. We're doing a jail project right now where we're looking at the health services that are given inside the jail. And with the suspension of Medicaid, which patients are, covered with private health insurance, can we figure out a way to cover them with insurance while they're waiting sentencing?
Yeah.
And then doing an analysis of what type of services that they get. We know that when they're let out of jail, that their Medicaid is supposed to come on instantly, but that's not really a reality, and it doesn't get turned onto the system, so they go to the pharmacy to pick up their prescription, and nobody knows who they are. They don't have Medicaid. They're charged the full out-of-pocket cost, which they walk away and don't take the medication. So we're trying to figure out how to pull all of those things together, and we've been looking at a lot of data in the system about how they've, the treatment that everyone's gotten and what's eligible for billing if we could possibly get them covered. But we're now stuck with a mountain of data and nothing to do with it.
Well, I have some thoughts, but do you have things you're trying now? Or I have some questions too, actually. So are your qualified health plans, under the Affordable Care Act, to contextualize this for other people, if you enroll in a qualified health plan on the exchange, you're supposed to be able to do that if you're pretrial in jail. Kind of tricky to figure out how you actually get meaningful coverage in jail, even with respect to drugs, medications. So I don't know. I'm wondering how that's working out with your plans in Maricopa.
Yeah, we actually looked at that. But when you start looking at what it takes to enroll them and all the paperwork and all of the eligibility that goes into it, and then by the time it starts, which is 15 days later or 30 days later, depending on when they came in, and when they churn out, you're really looking at maybe 8 days worth of coverage. For a small percentage of the population once you get it in place. The other implication is you took their eligibility while they were incarcerated, but that doesn't mean that that's where they're going to be in 2 months, and then they end up getting the bill at the end of the year because you've now enrolled them. So we've been looking at all of those different pieces, and I think what we landed on is to try to figure out if we can approach a health plan that has an exchange plan, Medicaid, and a private sector side, and ask them about enrolling pre-sentenced inmates as almost like a county employee. That the first day they go in, this is your first day of work. You now have coverage in the group plan. So that's what we're exploring to see if we can do first day immediate coverage in a plan that has that continuity so that we know the day that they get out, we transition them back to the Medicaid side or the exchange side. But in the meantime, we try to keep the same PCP because it's part of that network, and then try to, exchange information across. But that is our, Yeah,
that sounds super smart. It seems like the implementation will be also really challenging. But I guess, I'd love to get into the weeds with you later. But I think, for the rest of you, it just goes to show how much, service delivery can make a play, I think, in safety and justice too, and the ways it's kind of tricky, or trickier even than it is, for people outside. But the only other thing I've heard of people trying is partnerships with Walgreens, or people, pharmacies that sort of see themselves as moving to a community health center model. People that might be interested in fronting some of those costs initially, and then they, because they're more capitalized than your average person getting out of jail, can take advantage of that 90-day, retroactive reimbursement of costs. But your plan, if you can pull it off, it sounds really smart to me.
Yeah, it'll be a miracle.
Hi, you just made me think about something too. I'm Peter Bornstein. I run a nonprofit in Los Angeles doing designing diversions, post-booking, pre-filing for cities and the county who prosecute misdemeanors. I'm just curious, I got here late, so I might have heard something about other diversion projects you're doing, but how did you choose for the ones that you just said are super secret?
Yeah.
How did you choose pre-booking diversions? So like, it sounds like something that a police department would
It's
do.
basically partner driven. I mean, I'm interested in all kinds of diversion, but because we're working with the police department, that's why we're focused there right now.
Okay.
Yeah.
So earlier in some of the other CFA presentations, people were talking about parks and public space stuff. So that's where I'm coming from. And, there's the whole practice of crime prevention through environmental design as another way to just further upstream. Is that something that is like, it seems like there's this connect the dot opportunity.
Yeah, totally. I mean, like intellectually, like on a personal level, I'm super interested in that. I've done a little bit of reading on it, and I really like that concept and mode of thinking about basically how you can prevent crime by the way you design physical spaces, whether that's a streetscape or an apartment complex or a park. We haven't like delved into that at CFA, and it's interesting because then you think about like who will our partners be. I don't know. Some of it's sort of driven. By that,
part of the
but
dilemma is that the cities themselves are so siloed. So the parks department is not talking with the police department.
Absolutely. Well, and that's why we have the problem to begin with.
Yeah. The UK has this more holistic approach.
Yeah.
Where there is like a consultation with urban planners and police. So
there's actually a group in Baltimore that's led by inner city youth called the Inner Harbor Project, and they're doing that very thing. And their whole model is built around public spaces and the Inner Harbor Project in Baltimore.
Cool.
Jenny, as you know, we are Code for Jersey City, OpenJC. We are working on an alert system based upon police data. What I would like to know is whether we can partner with you to extend that to do community policing. How is that interface and what is that, and whether we can kind of partner with you to extend that?
I mean, I kind of think we already, like, I see myself as partnering with you guys, and I want to figure out how. So Open Jersey, do you want to say just like two seconds about what you guys are working on?
I mean, if I have to boil it down to 2 sentences, we are taking the 911 call data or all emergency call data, analyzing it to figure out trends in it, and creating alerts out of those trends. So if there's a spike in, say, bike thefts in certain months of summer in a certain area in the city, we would send text messages to the residents, alerting them, okay, the bike thefts are up, make sure you lock your bikes, kind of thing. But we get all the data, right? And we are analyzing it, so we have the data. So how can we do something that is preventive, like go towards the community policing instead of just making them aware?
I guess the challenge I would put to you in terms of community policing, and actually this is apologies to Brandon Bouillet of Seattle Police Department, and actually some other folks I was talking about community policing to earlier. But so 20 years ago, part of street level community policing is like we used to have all of our cop car windows like rolled up. Everybody was in their vehicle. And then it's kind of like, okay, let's get back to the street. Let's roll those windows down. Let's have a two-way communication and like walking around sort of really relationship focused. And that has to be about two-way communication. So I was asking some folks, like, what do you think is like the future 10 years from now? What will cops be doing in terms of social media that they're not doing now? And it was all about like right now, it's very one-way communication. Like I don't know if any of you follow police departments on Twitter, but I do, and it's a lot of just like alerts. And then if people tweet back at them, there's like no engagement. So, I mean, practically speaking, I don't know what that means for your tool, but I do think that part of incorporating principles of community policing into it would be a more like two-way communication model, so that you actually are really sort of like building that relationship between communities and police. But yeah, I mean, I'm super interested to see what you guys, I mean, just like the results of the data analysis that you're doing, I think will be super interesting and potentially like help, not just in terms of the alert system, but in terms of figuring out how to target interventions generally in Jersey City. I don't know that the police department would be doing that analysis, you know, on their own. And I think it could actually also like help them just like deploy more effectively. So yeah, I don't know. I think it's super promising and interesting, and you know, we should keep talking about how we can work together.
Sure. Thank you.
Okay. All right. Yeah.
Sure. Hey, I had a question about, can you say anything about like predictive policing or things like that? Because it seems like a natural.
I knew someone was going to ask this question.
Well, I'm from Chicago, so there's a crime lab in Chicago.
I don't know. Like, it's kind of logical that that's like one place that modeling would go. I mean, I don't know. I don't have like some like stump like opinion about predictive policing. It's not something we're focused on at CFA. But I'm not surprised other people are working on it. I don't know. What are your thoughts?
I don't. I mean, it seems like a natural outgrowth if you're trying to like change economic factors or something, figuring out what causes people to do crimes. But then I don't know if you like tapping people on the shoulder and letting them know you're watching them.
Yeah.
I know one project. So I know of one project that's a study being done by the Rutgers University around predictive policing or predictive crime prediction. It's primarily around what is called, if you could Google, risk terrain modeling and Rutgers University. So that is this group that is working on it. They're trying to predict the probability of a crime based upon geographical indicators. So their main thesis is just like if you create a playground somewhere and put a bunch of swings and slides in there, children will not naturally congregate out there. Similarly, if you have a boarded warehouse, some empty lots in dead-end alleys, crime will naturally procreate out there. And based upon that, they can predict crime. For example, they say that there is a certain, say, 30% more probability of a crime within 2 blocks of a bar, something like that.
Right.
So they have some predictions around that, but it's not about exactly saying, it's not like a Minority Report kind of thing.
Right, yeah. I mean, I think the implications
lines.
for environmental design are actually, yes, quite interesting. And the ways that data could inform that at scale are, that's interesting for sure. I think, where I get concerned is, well, it just doesn't ladder up to strengthening the practice of community policing, let's put it that way. But yeah, but I do think on the environmental design piece, it is interesting. Cool.
Thank you.
Sure. Thank you, guys.